The self-health declaration for Aliyah represents the moment when the Israeli government politely asks you to confess every embarrassing medical detail of your entire existence, as if preparing for a very thorough job interview where the position is human being worthy of citizenship. This document transforms you from a private individual into a walking medical encyclopedia, complete with footnotes, appendices, and probably a bibliography, if you've seen enough specialists. The declaration begins innocently enough, asking about your current health status, but quickly escalates into what feels like a medical inquisition conducted by very polite but extremely thorough bureaucrats. Have you ever had chickenpox? Obviously. Have you ever had therapy? Well, who hasn't after filling out immigration paperwork for 6 months? Have you ever taken medication for anxiety? Sir, have you seen the length of this form? The mental health section deserves special recognition for its ability to make perfectly stable individuals question their sanity. You find yourself scrolling through years of therapy sessions, trying to remember whether that time you talked to a counselor about work stress counts as mental health treatment or just expensive venting to a professional listener. The form doesn't distinguish between "I saw a therapist because my job was terrible," and "I require ongoing psychiatric intervention," leading to existential crises about whether your 3 sessions to discuss your mother's passive-aggressive comments constitute a psychiatric history. The medication disclosure section transforms your medicine cabinet into evidence for a very boring criminal case. Every vitamin, supplement, prescription, and that one time you took your friend's allergy medication must be documented with the precision of a pharmaceutical inventory. You discover you need to remember not only what medications you take, but also their exact dosages, which becomes an exercise in pharmaceutical archaeology when you realize you've been taking the little white pill for years without ever learning its actual name. Chronic conditions require documentation that would impress a medical researcher, forcing you to provide detailed histories of illnesses you'd rather forget. The form wants to know when your back pain started, probably when you began sitting at a computer for 12 hours a day, how it's treated, complaining loudly and buying expensive ergonomic chairs, and your prognosis, permanent membership in the society of people who grunt when standing up. You find yourself providing medical timelines more detailed than some historical documentaries. The family medical history section transforms every family gathering into a potential research expedition, as you suddenly need to know whether Great-Aunt Gertrude's nervous condition was actually a diagnosable psychiatric disorder or just her response to having 7 children during the Depression. Your family tree becomes a medical flowchart where you trace not only ancestry, but also the inheritance patterns of everything from diabetes to that weird thing your cousin has with his ears. Pregnancy disclosure creates particular comedy for women who must essentially provide a reproductive autobiography to people they've never met. The form wants to know about every pregnancy, planned or otherwise, successful or not, as if the Israeli government is maintaining some sort of international database of reproductive outcomes. Single women find themselves essentially submitting a report titled, "Why I Am Not Currently Pregnant, and My Complete History of Not Being Pregnant." The disability section requires you to admit to every physical limitation, no matter how minor, leading to confessions like, "I need reading glasses, and I can't touch my toes without bending my knees." You discover that the Israeli government wants to know about your mobility limitations, which forces you to acknowledge that climbing 3 flights of stairs leaves you slightly winded, and that you've been avoiding the gym for approximately the same amount of time you've been considering Aliyah. Medical record gathering becomes a quest worthy of an adventure novel, requiring you to contact doctors you haven't seen since the Clinton administration and request documentation of medical visits you'd completely forgotten. You discover that healthcare providers have widely varying definitions of comprehensive medical records, ranging from detailed novels about your medical journey to cryptic notes that read like ancient hieroglyphics. Some doctors apparently took notes in a code that only they understand, leaving you with medical records that seem to describe someone else entirely. The verification process reveals that different countries have dramatically different approaches to medical privacy, creating situations where getting your own medical records requires more documentation than applying for citizenship. Some healthcare systems hand over medical records with the enthusiasm of librarians sharing favorite books, while others guard medical information like state secrets, requiring notarized requests, sworn affidavits, and probably a background check just to confirm that, yes, you did indeed have your appendix removed in 2003. International medical record translation becomes an exercise in linguistic creativity, as medical terminology apparently doesn't translate smoothly between languages. You discover that your chronic lower back pain becomes something that sounds much more dramatic in Hebrew, while your seasonal allergies somehow translate into what appears to be a rare tropical disease. Medical translators develop specialized expertise in converting routine American medical complaints into Israeli bureaucratic language. The accuracy requirements create a peculiar form of medical perfectionism where you find yourself fact-checking your own health history like an investigative journalist. Did you really have pneumonia in 1995? Or was it just a really bad cold that lasted 3 weeks? Was that emergency room visit for food poisoning or just poor decision-making regarding gas station sushi? You develop a relationship with medical accuracy that borders on obsessive-compulsive, as if the Israeli government might conduct surprise medical history audits. Privacy concerns take on new meaning when you realize you're essentially submitting your medical autobiography to immigration officials, who probably know more about your health than your own family does. Somewhere in Jerusalem, government employees are reading detailed descriptions of your digestive issues, mental health struggles, and that embarrassing rash you got from trying a new laundry detergent. Your medical privacy becomes a casualty of your citizenship dreams. The psychological impact of cataloging every health issue you've ever experienced creates an unexpected form of medical nostalgia. You find yourself reminiscing about illnesses you'd forgotten, remembering the names of doctors who treated conditions you haven't thought about in years, and developing an oddly comprehensive understanding of your own medical journey. Some applicants discover they've lived more interesting medical lives than they realized, while others feel like medical underachievers for having so few dramatic health events to report. Age-related considerations add another layer of complexity, as older applicants must provide health histories that span decades and potentially multiple healthcare systems. Elderly immigrants find themselves documenting medical journeys that predate electronic medical records, requiring them to remember details about treatments they received when Carter was president. The health declaration becomes a medical memoir spanning multiple decades of healthcare evolution. The timing coordination between health declarations and other Aliyah requirements creates a bureaucratic ballet where medical information must align with immigration timelines, consular appointments, and the mysterious scheduling preferences of Israeli government offices. You discover that your health status has an expiration date for immigration purposes, as if your medical conditions might spontaneously change if you don't immigrate quickly enough. Specialized medical conditions require consultations with Israeli specialists who must review your case from thousands of miles away,